Bonjour tout le monde. Hello, everybody. Welcome to today's N4 webinar on Indigenous Peoples Day. Culture is Healing, Exploring Root Causes of Indigenous Health Inequity. Now, before we begin our presentation today, we would like to begin with an acknowledgement that N4 is hosted at GEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Andrew Tomeyer. I go by the pronouns he, him, and I am N4's Education Coordinator. I will be hosting and moderating today's presentation. Alongside myself, we have my colleague and co-host, Mariah Maddock, Team Lead of Knowledge Generation and Mobilization, as well as Colleen Drake, Engagement Coordinator, who will be monitoring the Q&A box today. And I'm now pleased to introduce you to today's presenter, Dr. Sarah Funnell. Dr. Funnell, I'm going to ask if you can please turn on your camera as I introduce you. Dr. Funnell is a First Nations family physician and public health specialist. Dr. Funnell is the founding director of the Center for Indigenous Health Research and Education at the Faculty of Medicine at the University of Ottawa, as well as an assistant professor in U Ottawa's Department of Family Medicine with a cross appointment to the School of Epidemiology and Public Health. She's also director of Indigenous Health with the Department of Family Medicine at Queen's University. Along with that, up until April of 2022, Dr. Funnell was Associate Medical Officer of Health at Ottawa Public Health, of which through the last 2 years of her role, she directed her attention towards supporting the COVID-19 response. Dr. Funnell maintains her passion for family medicine by providing primary care services to underserved communities in and around the Ottawa area. Thank you for joining us today, Dr. Funnell. Today's session is being recorded and will be uploaded to our N4 platform. We'll share this with you as soon as it becomes available. Should there be any technical issues during this presentation, we'll inform you with details for an alternate makeup session as well. And before we begin today's event, I would like to take a moment to introduce you to our platform features to help enhance your participation experience. Throughout today's session, we invite you to write your questions in the Q&A window. We know that some of you may have the same question or be interested in a particular response, so you also have the option to upvote a question. Please upvote questions you're interested in hearing the answer to, and we will prioritize which questions we pose to the speaker first. And with that said, our speaker has no conflicts of interest to declare. So let's jump into today's presentation, and I will pass the virtual podium over to Dr. Funnell. Take it away.
Miigwech, Andrew, and to our co-hosts, and particularly miigwech to all of the attendees that are with us today. It's a great, beautiful day here in Algonquin territory, and I wanted to begin by acknowledging that we're on these beautiful lands, Algonquin territory. I'm Algonquin myself. This is my traditional territory, and we share it with settlers and our relatives from other First Nations, including Métis and Inuit people. Today is a day to celebrate and recognize Indigenous peoples here on this land that some of us call Canada, some of us call Turtle Island. And so miigwech again for joining us today. We're going to explore some concepts. We're going to together unpack the root causes of Indigenous health inequity. We will, together discuss some ways to address Indigenous health inequities. And I hope in the end, I'll leave you feeling like there's something that each of you can do, because I can tell you that with over 160 of us on this webinar right now, collectively, we can make a big change. And so I reached out to Algonquin Elder Simon Brocupe this morning to ask him what summer solstice means to you. And this is what he told me. He said, today is a reminder that we must respect original instructions. And so he said, the sun, the moon, and stars were given original instructions by Creator. Humans were given instructions to keep the water, air, and earth pure. We give thanks to the sun, moon, and stars for obeying the original instructions. And so I think with the threat of climate change and the new recognition of planetary health, that this is a very special time for all of us to reflect on our responsibility to Mother Earth and to treat her well, just like you would your mother. Take care of your mother because she has given you so much. And so these are Indigenous perspectives and worldview, particularly from a First Nations perspective. And it's hard to understand how such beautiful worldviews and spirituality could have been attempted to be erased by colonial powers. And despite all of the policies and methods used to erase our culture, we are still here. And today on June 21st, summer solstice, is a beautiful day to remind us all that First Nations, Inuit, and Métis people bring to our culture. And so today's session may evoke some uncomfortable thoughts and feelings. And I often tell people that if it doesn't, I might not have done my job right. So it's okay to feel uncomfortable. And I think it's important that we recognize the discomfort that these discussions bring to us, and that it's part of a learning journey that we're all on, including myself, on a learning journey to reclaim pieces of myself and my culture that were lost. And so with that, I'm just going to tell you a little bit about who I am. So I'm Sarah Funnell. My Algonquin name is Minwanamad, which means pleasant breeze. And this is a picture of me from an undisclosed era. And I'm sitting on my grandmother's lap, and great grandmother's lap. And her name is Sarah. I'm named after her. And she originated from Six Nations. And if any of you are from the Toronto area or the Niagara area, Six Nations is a Mohawk community in that region. And she was born there. She found her way to Tuscarora Nation, which is in Upper New York State, which is where she lived. She married a man from Tuscarora, and they raised my grandmother there. And so this is a picture, and her sisters and brothers and cousins and everybody. And my great grandmother, Sarah, her original name was Sarah Doctor. It was really, I think that's quite funny because I'm Dr. Sarah. And she was a traditional midwife. And so she helped women, you know, before they delivered their baby, during the delivery, afterwards. She supported women bringing new life into this world. And they always called her the doctor. And I think that's because you know, she didn't just care for the delivery part and then her job was over. It was really caring for the whole community and ensuring their wellness. So I think, you know, I was meant to be a doctor, a promoter of wellness, and I think it must have come from her. Standing beside her is my grandmother. She's still alive. She's 97 years old, and she's the oldest person living in Tuscarora. in the last few months, she just got her honorary high school diploma from the local high school. It's a beautiful story about her on graduation. And she still lives in Tuscarora. She had 5 children. My father was the oldest, and that's him um, with his beautiful head of hair. And he grew up in Tuscarora, and eventually made his way to Algonquin territory. And I'll tell you a little bit about that now. So here's a picture of my great grandfather. He was the chief of Kitigan Zibi. I'm a band member at Kitigan Zibi. It's near Maniwaki, Quebec. And my grandfather was one of his sons, and his first language was Algonquin. Then he learned French and then English. And sadly, my grandfather never passed down Algonquin or French to his children. And I asked my dad why he thought that was, and my dad said he didn't want his children to experience any additional discrimination based on language. And so the family grew up speaking English. My grandfather, he wanted to fight in World War II here for the Canadian Armed Forces. But if he did that, we would have lost our First Nation status. At the time, under the Indian Act, if you were a status Indian and you became a member of the military, or you became a doctor, a lawyer, or a teacher, any sort of professional like that, you lost your indigenous status under the Indian Act and all the rights that came with that. And so he had the foresight to not to recognize that that was somehow important to preserve our rights under the Indian Act, although they took many of our rights away as well. Nevertheless, he ended up fighting for the US, and he fought for the US Navy. He ended up in Tuscarora, where he met my grandmother, and lived most of their lives in Tuscarora, but spent quite a lot of time in Kitigan Zibi as well. And so my grandfather died about 15 or so years ago. It was very interesting. He had a stroke, and when he was able to speak again, he was speaking Algonquin. And it's just incredible how that maintenance of that first language is always preserved deep down in your soul. And it's just a beautiful thing. My father, who grew up in Tuscarora, he found his way to Algonquin territory, and he ended up going to college out at Algonquin College. And maybe some of you are attendees at Algonquin or graduated from Algonquin College. And he got a room in my mother's house. So my mom here, she was the youngest of 8. She was an Irish Catholic, 3rd generation. And when she married my dad in the late 1960s, she attained legal status as an Indian under the Indian Act, because at that time, and maybe you don't know this, but you soon will, the Indian Act is not only the only racist act in the world, I've heard, it's also a sexist act. And so in before 1981, when this particular part of the Indian Act was repealed, women white women, or any other racialized women, I suppose, who married a legal status Indian, they gained status. If you were status Indian woman and you married a white man, you lost your status. And so losing status meant that you were enfranchised, which then meant you were a citizen of Canada, and with all the rights that are given to citizens of Canada. So you could then vote, you could then own property. You had freedom that you didn't have under the Indian Act. Under the Indian Act, you were not permitted to own property. There was often Indian agents on First Nations reserves that would give you a pass if you met certain requirements to leave the community to go into town or buy something. So the Indian Act was really a way to control the movement of First Nations people and also identity, including very specific control over Indigenous women. And so this is a picture of me and my mother, who was a white woman that became a status Indian. And when I talk about this with my children, I'm now a wife and a mother of 3 children. They say the most amazing things like, "Can you change your race like that?" And it's like, no, you actually can't change your race. But the Indian Act certainly made efforts to try to do that. My parents got married really young because, my mom was Catholic, and you sometimes see that, especially in the 60s. So they got married before they were 20 years old, and the marriage didn't last. And eventually, my mom remarried the chief of Alderville First Nation, which is Mississauga people, Ojibwe people, and that's where I grew up. And here's a picture of my children with their cousins in Alderville First Nation. And so, on this beautiful day here in Algonquin territory, I just want us all to pause for a moment to think about what it is that we need to be healthy. And so I encourage you to write in the chat what it is that you feel you need to be healthy, but it's really for you to recognize what you need. And so you don't have to write it in the chat, but you can share it with a person or write it on a piece of paper. But we're going to give ourselves 60 seconds to do that. I'm timing. So I'm seeing all kinds of wonderful things about nature and loved ones and supportive environment. And I saw someone say mountains, security. Yeah, there's another mountains, shelter, doing what you love. I saw someone say freedom. I saw someone say meds, which is, that is true too. Autonomy, all of these things. And it sounds like what a lot of you are getting at is social determinants of health and the ability to determine for yourself what you need. And in the Indigenous context, that removal of being able to determine for ourselves what we need to be well is it's driven by colonial policies that persist even to today. And so thank you all for sharing what you need to be healthy. I agree with a lot of those things. I need that too. And I love that. We're seeing some spirituality as well. So, we all need similar things. And it's really dependent on our life circumstance and our situation. And so I just wanted to share with you one stat. I'm a physician. and an epidemiologist. And I know I start to fall asleep when I see a lot of graphs. So even though I love graphs, I just wanted to share this with you. And I want you to take a quick look, and if and just think about it. So now this is a this is a public health agency report. How healthy are we? And it is using a binary concept of gender by male, female, and we all know that in real life, it's not binary. And in the Indigenous context, we've often recognized that people that are two-spirited are special people. And so you can see my pronouns are Kwe, she, her. And my sister recently told me that Kwe, which is Algonquin for she, her, is a neo pronoun, because originally we did not have binary pronouns. But the point of the graph is that there is a difference in life expectancy between Indigenous people and non-Indigenous people on this place some of us call Canada, and it's quite significant. So you can see over a 10-year difference in life expectancy in some cases between some Inuit groups and non-Indigenous people. And so I just wanted to like unpack that. And this is where we're going to hit that objective of exploring what the root cause of this is. And so again, we'll communicate in the chat that there's a difference on how long people are going to live at birth based on race. And so just by being born First Nations, Inuit, or Métis, you're already expected to live fewer years than non-Indigenous people. And so some people think like, well, maybe that's genetics or some other reason, but truly it's racism at the core. And so let's explore that a little bit. So using the chat, based on what you know, or take a guess, what are some causes of health inequities that you're aware of amongst Indigenous people? So we'll just take a minute, get the juices flowing. Access to services, racist providers, unsafe water. We're looking at food insecurity, poverty, primary care services, feeling excluded, housing. And how do those trauma, for sure. Yeah, I know, Maslow's hierarchy, right? Like to all those things that you need to be well. And how does it play out in the health that you see, or that you might see, or that you've read about? Health conditions. So Sabrina, thank you. Higher infant mortality rates. Now, it's unbelievable, right? That in a developed country like this, that we would have particular racial groups with higher infant mortality rates. It's completely true that there are, and completely unacceptable, right? So I saw higher rates of diabetes, addiction due to trauma, tuberculosis. So there are some groups with higher rates of tuberculosis, like the rates are comparable to rates of tuberculosis you'd see in places in third world countries like Africa. HIV rates are higher in some Indigenous groups. There are more environmental hazards. So, and then Michaela's, saying that in US there's higher infant mortality rates among Black women. Oh, that's an incredible finding for sure. And again, unacceptable. Oh, thank you, Charlotte, in countries like Africa. Yeah, 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 thank you. Africa is a continent. Thank you. Okay, so see, it's a lifelong learning journey, including for me. So when we look at in the Canadian context here, let's unpack some of this a little bit. And so we could pick any Indigenous, you know, health inequity that you've identified, but in all of that you have identified, let's look at, I'll just pick one that you've mentioned here, and we'll do, let's say tuberculosis. We could do anything, but we're going to pick tuberculosis. I'm picking it. So there's a problem with higher rates of tuberculosis in some Indigenous communities. I'm defining the problem, and we're going to unpack it. So I'm going to ask you why that is, and then you just throw it in the chat. So the problem is, there are higher rates of tuberculosis in Indigenous people. And why is that? So why is that happening? So we have overcrowding. Talking about housing, so lots of people in the same house. So we're seeing safe housing. Okay, so let's just unpack that. So why are we seeing unsafe housing, which includes sanitary conditions and water? So unsafe housing conditions, why is that? So why would Indigenous people be more likely to live in unsafe, crowded, unsanitary housing? So lots of responses. It seems like it's often coming down to expense about funding, about money, about resources to build adequate housing. And I've seen someone mention, I'm just scrolling back up here, that there's displacement from original lands. And I think, Grace, you brought that up, and that's really important, that like in this exercise, we're oversimplifying it, but truly that there's multiple things happening at the same time. We can sometimes call that, intersectionality, but that there was this imposed, displacement of people from their traditional lands to more sedentary type of living and without the appropriate resources to build safe and adequate housing. And so it is truly, when you look at it, it is discrimination. And so if in this exercise, what is that, what is the role that colonialism and discrimination and racism play in ensuring that Indigenous people no longer live on their lands, but in these less than adequate housing structures? So why is that? Like, why is that? Why do we see that? Stolen land. So it comes down to like that removal from the traditional territories into these reserve systems. Métis people were moved to settlements. There's a really interesting concept and tragic about road allowances, where Métis people could only, live in certain parts of their traditional lands. Inuit were relocated, and there's powerful stories about the relocation to, almost experimenting, taking this group and plopping them in this other remote area and watching them, survive. It's incredible. And so it's like, it's about land, right? it's about land, and these powerful forces and policies and processes were designed very specifically to remove traditional people from our lands. And why was that? Like, what was so important about this land? Settlers wanted resources, right? When you look at these beautiful lands, Algonquin territory is so beautiful, all across from coast to coast to coast, these beautiful lands, what they represented, and it changes over time what they represent, but it's resources, right? And it's just the way we started about planetary health and preserving our Mother Earth was ingrained in all of the Indigenous people of these lands. And then you can see the gradual removal of culture, which was very deliberate for the resources of these lands. And I can tell you, I've done this exercise hundreds of times, and this group got to the root cause the fastest of any group I've ever been to. Of course, there's over 200 of you and you're playing off each other, and I can see some of you know a lot of the history of the land and how it was stolen. And it was this idea that that there was no one living here, that no one owned this land, so it was free for the taking. And we know today that that was not at all the case. But this was called, terra nullius, and the doctrine of discovery. And these were truly the lands that First Nations, Inuit, Métis people took care of and are still trying to take care of today. Plain greed. I think we'd have a really good time if we're in person with this group. And so I really love this oversimplification of social determinants of health from an Indigenous perspective. And it's an article by Jeff Redding, and it talks about the distal, intermediate, and proximal determinants of health, and that these proximal ones are a lot of what we talked about earlier on, what we need to be healthy, right? Like we need money, housing, food. These are what we see in our clients and our patients that have the most direct impacts on their health. But there are forces at play beyond those that are really powerful. And we have the intermediate determinants of health. In the Indigenous context, it's all of the systems, the healthcare system that we work in, the educational system, all of that. And there's these other more distal, profound, powerful determinants that are affecting the intermediate ones. And that's that colonialism, racism, discrimination, and self-determination, which was all these policies like the Indian Act and other policies to ensure that Indigenous people were controlled. That's what racism is power control over people. And the Indigenous context, it was for land and resources. And so they're very, very, very powerful. And so I love this quote by my colleague, Marcia Anderson from Winnipeg, Manitoba. She says, from now on, instead of vulnerable people, I'm going to use the phrase people we oppress through policy choices and discourses of racial inferiority. It's a bit longer, but I think it will help us focus on where the problems actually lie. And so I encourage all of us to, instead of using the term vulnerable people, that we use the words that really describe what's happening instead. So in Marcia's example, she's saying people we oppress through policy choices and discourses of racial inferiority. That is excellent. Of course, it's from Marcia. But in our everyday language, when we're talking to our colleagues, I would encourage you not to use the term vulnerable people, because one of the things the COVID pandemic has shown me is that there are people that were truly vulnerable in that biological sense to poor outcomes and death because of COVID-19, like the elders, or you had you were undergoing cancer treatment with chemotherapy that made you more vulnerable to COVID-19. But then there was also other groups of people that we said were vulnerable people, and those were people that were oppressed through policy choices and discourses of racial inferiority. And so, people that experience poverty or lived in crowded houses, or low-paid frontline workers that we all know about. And so when we talk about vulnerable people, it's really important to describe what we actually mean, because that as we can see in the chat, vulnerable people, that term is really disempowering, and racism is all about power. And so in terms of racism, this is a really oversimplification. It's obviously much more complex than how I'm going to describe it, but very simply, it occurs on multiple levels, including the interpersonal level. So the way I describe that is often like hate crimes. For example, there was a woman in Thunder Bay that died after a trailer hitch was thrown at her. That is interpersonal racism at its core. It's upheld by systemic racism. So all of our systems are built on a certain worldview, and then we're trying to fit in different worldviews into a system that's built on a Eurocentric worldview. And so we have systemic racism at play, and it can go unnoticed and undetected if you're part of that dominant group. And I'm sure all of us have seen that play out in the systems where we work. The saddest form of racism, in my view, and the most tragic, is that internalized racism. And in the Indigenous context, it is, where Indigenous people believe what is being said about them, those false narratives about who we are and where we come from. And the end goal of assimilation and policies like the Indian Act were that Indigenous people would hate themselves. That was the end goal of assimilation, because the thought was, or the theory was, if you hated yourself and hated where you've come from, then you would more easily adopt that Eurocentric worldview and ways of being. And to some extent, maybe that's true for some people. A lot of the times, at least in my experience, is that it also ends up with self-hatred. You hate yourself, you hate your culture, you hate where you come from. And so when you think about it, when you hate yourself, you're not good to yourself, right? You don't treat yourself well. When you hate your culture, you're not good to those around you. And so it really takes a strong healing to come back from that. And we do see an incredible resurgence of Indigenous culture. And so it's really like all of these efforts at all of these levels to fight this powerful force of racism, so that Indigenous people can live freely and well again. And so you've likely heard terms cultural awareness, sensitivity, competence, and safety. It's been described on like on a continuum that we try to teach providers about: service providers, social services, healthcare providers, teachers, because we want Indigenous people to seek services where they feel safe. Because as you've indicated in the chat, if you don't feel safe, you're not gonna get services. It's quite a barrier. And so it starts with a cultural awareness. This has been described. You're aware there's a cultural difference. Sensitivities, you're adapting your services somehow. And competence is used often to describe all of this. But what we're looking for is a safe environment for people where they can seek services. And so it's much more complex than just saying the words cultural safety or putting up a poster or a land acknowledgement, although those are important too. It also requires us to have some skill sets. So skill sets in being anti-racist. So we all know now it's not enough to just not be racist. We need to be actively anti-racist and addressing and having all, supportive environments where we can do that. And we need to be trauma and violence informed in providing our services so that we can incorporate those principles of trauma and violence informed care to ensure that we're providing safe services. Cultural humility is if you work in environments where there's different people from different cultures than yours, you'll know what this feels like to not know and to be humble about it. And I give an example when I used to work in primary care in Akwesasne, which is a Mohawk community near Cornwall. A lot of people there have Algonquin Mohawk names. And I was always afraid to try to say them because I didn't want to get it wrong. And instead I would just avoid it or use their English name that was on file. And I really regret that. I think if I had at least been a little bit more courageous, that I don't know, I'll never know unless I go back and do it again. But that it would have made people feel seen. And so now I just try harder. It takes more time, but people really do appreciate and feel seen if you're at least trying. This is my quick example of what cultural humility is, but it can look different depending on the scenario. What we're finding is really more powerful, and I think it needs a lot more thought, is healing-centered care. And so in the Indigenous context, I hope that I've shown you along the way that we have a lot of powerful, beautiful healing practices. And there's, a lot more for me to learn on my own healing journey and all of us to learn, but that healing-centered approaches really do take a strengths-based approach to healing. We could do a multi-day workshop on just that one slide. But these are the recipe, I think, that you need to provide culturally safe care on an individual level. But you also need to work in spaces that support you in having a culturally safe organization. And there's this lovely article, I love it. It's pre-pandemic. It's bringing reconciliation to healthcare for leaders by Healthcare Can. And it has several domains about how we can ensure that organizations are culturally safe, and it requires policy and system change, no surprise, community engagements. So this is the thing, and Indigenous client care and outcomes. This is the thing about culturally safe care. You don't know that you're culturally safe unless your clients tell you that you are. So if you don't ask, you don't know. So how does that work? You also need recruitment and retention of Indigenous employees, and then anti-racism and cultural safety training for everybody. So part of the recipe, an important part, is trauma and violence informed care. And maybe some of you have gone through this training, but I encourage all of us to, it's almost like a practice that you have to work at every day. And it starts with awareness that anyone could have experienced trauma. And I think in a lot of the work that you do, you probably do come across that. So awareness is an important principle, that we need to ensure that our clients have a sense of safety and trust. And there's different methods and interventions to ensure that we're doing that to the best of our abilities. The language we use is really important. You know, there's person first language and non-stigmatizing language that we can practice. I need to practice. And that trauma is a risk factor for many things, many health outcomes, as many of you have probably come across in the work that you do. And these are part of the recipe that we need to ensure that we are doing the best that we can do in our work. And I think those principles of trauma and violence informed care help us too, as service providers, understand our patients, and help us to see that if a patient, client, someone seeking services is upset, that it may not necessarily be like something personal. I remember the first time I was yelled at by someone that was seeking my care. I was a learner, I was a trainee. I took it very personally. And I think that that person taught me something really important. And I've been on a lifelong journey to unpack that. And I'm grateful for that person for what they taught me about being trauma informed. And so this newer concept is really from this amazing, brilliant Black scholar, Dr. Gin Wright, who's been describing healing-centered care. And, you know, instead of trying to put bandages on people's wounds, which we need to do as well, we also then can move to healing-centered care and ask, what is right with you? And so the second thing I'll challenge us all to do is, it's really fun with my kids. If you have kids, try it. Is to ask, so what's right with you? You know, especially wonderful if it's someone that you have a longitudinal, continuous relationship with, because you know you'll get to know them a little better and ask them what's right with them. And so, you know, in the first challenge is to not use vulnerable people, and the second challenge is to try to find different ways to move to healing-centered care and ask what's right with you, what's right with your clients or people coming to see you, or your colleague, you know, in the morning. Hey, what's right with you? Now, I'm not trying to say we should employ toxic positivity. We also need to understand you know, the challenges that people face too. So it's you know, it is really a balance of all of that. So if someone tells you, you know, I'm feeling suicidal today, I'm not suggesting you say, well, what's going right with you right off the bat? We still need to, you know, validate people, but then part of their care or their plan going forward is to understand what the strengths are. And so given strengths that, you know, Indigenous people, First Nations, Inuit, Métis people, we have a great deal of strengths and some major contributions to this nation called Canada. And our love of Mother Earth is what grounds us and also pains us at the same time. But this is summer solstice, and I would encourage each and every one of you to explore the summer solstice at this time. And I just wanted to add this last slide for you right here that this week in Algonquin territory, we're celebrating summer solstice at a festival. Everyone is welcome. Every colored skin and gender and sexuality, you are welcome, and to explore Indigenous culture and see our strengths with your eyes, and explore all of Algonquin territory this summer, because there's going to be a lot going on, powwows, music, and you can see with your own eyes what brings us joy, and how we celebrate our culture. And so with that, I will say miigwech for your time and your participation. Incredible. And I think we'll move into Q&A in the last like 10 or so minutes. Does that work,
Yeah.
Andrew?
Yes, of course. And thank you so much for this excellent presentation, not only on your own family history, but also just such a heavy topic to discuss and recognize, not just today, but every day to be aware of, be recognizing it and being aware of it in our own lives and such. So with it, we do have a few questions, and also thank you again for the excellent attendees in the chat. There was a lot of discussion going on, a lot of conversation, and we can continue that as well going forward into our meeting place on the N4 website after this presentation. So one of the questions we had was, there's such a disparity between Indigenous and non-Indigenous life expectancy, as you mentioned in your presentation. There's about the same gap between men and women. Inuit men and women, though, have that 9-year gap. But do we have a sense of why Inuit men in particular are experiencing such terribly shortened lifespans?
Um, I'm not entirely sure. It's certainly, you do see a difference between First Nations, um, Inuit and Métis people life expectancy, all less than non-Indigenous people. Um, and so I'm not entirely sure why it is. I can guess though. My best guess is that so in the north, there's higher rates of tuberculosis, higher rates of infant mortality, and that, so keep in mind again that that is life expectancy is the expected length of life at birth. And so it's you're born into a world that is systemically racist against you, and the forces begin uh, right from birth. And so, you know, part of the exercise that we went through today was to unpack that. We started with tuberculosis, but we could have gone down any other arms of that and looked at rates of infant mortality and why it is that Indigenous infants are more likely to die in infancy. And we can see, you know, usually we get to the same conclusions, that it's about culture and removal of culture and poverty, um, and 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 so poverty is an extremely powerful determinant of health as well. So if anyone that experienced poverty, you're more likely to die earlier as well. So it's multifactorial, and for whatever reason, a bit stronger in Inuit men. But the exact root cause of that, I'm not entirely sure. But it's multifactorial. But the root is racism for sure.
Of course. And yes, of course, the intersectionality of many issues leads to the state that currently exists nowadays. Um, Although we are short of time, I have one quick question. So, with the social justice movements that have been exponentially growing over the past quite a while, along
Mhm.
with development of, say, the Truth and Reconciliation Committee, what hope do you have for the future?
It's really interesting. Many years ago, there was the Oka crisis, and those of you that are from this area and have lived here long enough may recall this incredible crisis that happened. And it was about traditional lands. There were burial lands, traditional lands of the Mohawk people. And the town of Oka wanted to build a golf course on these lands. And there's some really great films about it. What was interesting about that was that there was a huge standoff, and someone died, and they were shot. And a really good friend of mine, Wanique Horn Miller, was there as a young woman, and she was stabbed by the bayonet of a long gun um, that was the military had. And I think she was 15. What's interesting about this story is that it played out in our nation of Canada, which we have very deep narratives about Indigenous people and practices, and being like uneducated and uncivilized, and there's opposition towards this civilized game of golf that needed to be put on this land to make money. And what is amazing about this story is that the world was watching from outside of Canada, and the world was very supportive of Indigenous people and this and their uproar against the the lands being used for this purpose. And so you can see this play out even today when we look across the nation at some of the Indigenous groups that are fighting pipelines, or even No DAPL in the United States. And the world is watching, and the world knows that some of these, capitalistic projects are harming Mother Earth, and you can see that there's like support. Um, and so that I've even forgotten your original question, Andrew, but um, I I guess my point is I do feel hopeful, particularly now that people are paying attention to planetary health. It was Indigenous people that experienced mercury poisoning, because of industrialization and pulp and paper mills, and people weren't listening. But now that everyone feels the threat, um, I feel hopeful that, you know, Indigenous people will be turned to for some of the solutions that we've had forever. Elders say we have everything we need to be healthy. We have it already. And we just need to be able to have the power to practice our traditional ways, which is really about loving Mother Earth, taking care of Mother Earth, and respecting all beings. We say all of our relations, all of you are my relations, and I love you all. And if we say more things like that and practice more things like that, we'll all be in a better place. And it's not just about me as an individual making enough money to get by. That is important, the Maslow's hierarchy of needs. But if we all work together, and that social justice movement that you're talking about, together, we can make a really big impact. And so I think, in this time of, Indigenous Peoples History Month and Pride Month, in my house, my kids say it's the best month of the year. It's both the combination of seeing us all as all of our relations, um, and loving each other, that can get us to a better place. And that brings me hope for sure.
Thank you. Yeah, thank you. And
You
that's
bet.
been a very, very powerful discussion today. And before we wrap things up, are there any final words that you would like to give to the audience before we
Well,
go?
let's remember those those couple things. So we're going to try not to use vulnerable people. We will ask people what's right with them. And don't forget to tell some people you love them. How about that? Is that good?
Sounds great.
Hug a
Thank you.
tree.
Yes, thank you so much. And thank you so much to the audience as well for
Oh,
being
great
here today.
audience. Yeah,
Yes,
miigwech,
excellent
everybody.
discussion. Yes, indeed. And we will definitely be moving a lot of this to the meeting place side of the N4 website with the posting of the presentation as well. And so with that, thank you very much, Dr. Funnell, for taking time to participate in today's discussion. And many thanks to you, the audience, for joining us and engaging with us today. Miigwech. You're welcome to join us again for any of our upcoming events as well. And if you missed any part of today's presentation or would like to watch this session again, we will be posting the recording to the N4 platform within the next week or so. We want to continue this dialogue as well. As stated, we'll be moving all the questions that we haven't had a chance to address to the N4 moderated discussion forum called the Meeting Place. And we've invited Dr. Funnell to be responding to the questions there. We've also curated several resources related to today's presentation topic, and you can find these in our resource toolkit, and we will link them when we share the on-demand version of this presentation. So if you haven't yet, please sign up to newcomernavigation.ca for all our resources and learning opportunities. Along with that, following this session, you'll be invited to complete a survey to share your feedback with N4. We take these surveys very seriously to continuously improve and seek out new webinar content and opportunities that are responsive to topics that you, the audience, are interested in. We ask that you follow the link or complete the brief survey that may pop up afterwards. And with that as well, check out our N4 mobile app available on Apple and Android devices. I'll leave the QR code here for a couple seconds if you have the opportunity to scan it. But if not, check it out at newcomernavigation.ca/iOS or Android for more details on how to download it and take N4 with you on the go. Thank you again. Thank you again, Dr. Funnell. And we hope you can join us again at a future N4 event. Stay safe and stay well, everybody.
Miigwech.